A provocative column we saw in the Wall Street Journal. It is about the drugs called statins. In fact, one of them, Lipitor, may be the most widely prescribed drug in the nation. But some people are claiming an unpublicized side effect from the medication: memory loss, difficulty concentrating, fuzzy thoughts. Today, 69-year-old Jane Brunsey loves volunteering for her granddaughter's middle school. But not long ago, her memory was so bad, while babysitting, she even lost track of her granddaughter.
I didn't want to talk on the phone because I couldn't think of what to say. I didn't know the words to answer people that asked me questions. I began to see the people I was talking to looking at each other kind of funny.
Her daughter Kristen was so concerned she explored getting Alzheimer's care for her mother and refused to let her babysit for her own grandchild.
It was devastating because she's just as important to Rachel as I am.
But Jane says it wasn't old age causing the memory problem. It was her cholesterol-lowering drug, or statin.
When I decided to stop taking Lipitor, within about 8 days, I would say, I was back to normal. I literally had to change doctors in order to do that.
Statins are used by millions of Americans in the hope of reducing the risk of a heart attack. And while they've saved thousands of lives, they have well-known side effects like muscle cramping. But is there a less publicized side effect? Memory loss. Dr. Beatrice Gullum runs the Statin Effect Study, where for the past 6 years, patients on statins have been able to report their own side effects to her website.
Of the first 1,000 or so reports that came to our office, 48% of them reported memory problems.
These side effects, can they mimic serious diseases like Alzheimer's?
They don't remember where they went earlier that day, what they had for breakfast.
Pfizer, the maker of Lipitor, tells ABC in a statement that the clinical trial data, quote, does not establish a causal link between Lipitor and memory loss.
10.
But for Jane Brunsey, who now controls her cholesterol through diet, the link was clear.
Good. I don't want to be the person in a nursing home with the lowest cholesterol. You know, I would rather have a high cholesterol and have a life.
And now on call, Dr. Timothy Johnson, who is ABC News medical editor. Tim, what about this? Thousands of people reporting anecdotally everywhere that they have word and memory loss on Lipitor. What does this say to you?
Well, I think we have to take these complaints seriously. I want to put it in perspective by pointing out that the company that makes Lipitor, one of the statins, has about 145 million years of patient experience in over 400 studies. They say that about 2% of people will report some kind of memory loss. The study that you quoted in the piece, that's a self-selected sample. In other words, these are only people who think they have a problem and therefore report it in. So that doesn't really tell us much, except for those people's experience. But I think when a patient complains of this, we ought to absolutely take it seriously. And if they really need a statin, if they can benefit from a statin, we ought to lower the dose or switch to another statin, which in many cases will take care of the problem.
But 2% could still be a lot of people, right?
It could be a lot of people. We have no idea what the status of those people is. These are just reports that come in over the transom, so to speak. But again, my attitude is if a patient is complaining about it, you take it seriously, you go over it with them, you see if there are other reasons causing it. If they really need the statin, if they've already had a heart attack or stroke, or they are at high risk for heart attacks and strokes and can really benefit from the drug, try another statin. I know personally some people who have done that, and it's worked just fine for them. Worst case scenario, you stop the statin and use other means to lower cholesterol.
Well, my question is it just Lipitor or is it all statins? And what could conceivably be the reason a statin was affecting the brain?
Well, the statins, of course, lower cholesterol, and our brain is full of cholesterol in the linings of our nerves. And so it's theoretically possible that if we change cholesterol levels, it might affect brain tissue. We don't have hard proof of that, but it certainly is theoretically possible. And as to the Lipitor, we get most reports on that drug because it's the #1 seller, but we have heard reports with other statins also.
And we've heard that by and large, these are women who are reporting it more than men. Is that a coincidence of some kind? What do you think that would be?
It could be. It also could, and I'm using a lot of coulds here because we don't know for sure, it could relate to the changing hormonal milieu of a woman as she enters into menopause. We certainly have heard these reports from men too. So it doesn't appear to be specifically tied to gender. But again, I want to emphasize, if a person has this problem, talk to your doctor, see about lowering the dose or switching to another statin before you give up on the drug, because if you really need it, the benefits will outweigh the risks.
There is a vitamin niacin, right, that has some cholesterol-lowering properties, but is it as good as a statin if you need to switch off statins altogether?
It isn't as good, but it does work, and the problem with it usually causes side effects such as facial flushing. There are some new versions of niacin coming out that appear to be better in terms of that side effect. So that's one alternative among several for people who have to go off the statins.
All right, Tim, always good to hear from you. Get perspective on this. And if you're having any problems out there, want to ask about Lipitor, visit abcnews.com. And our special on-call section is on heart disease. You can find it in the health section of abcnews.com.
Sacrifice our own families on the altar of these medical doctors. And Dr. Blaylock is a medical doctor. I'm not going to go through his giant bio. Read it at BlaylockReport.com. But I wanted to get you on, sir, to talk about this issue, because now we've got brain disorders, as you know, exploding. You got people at 30 years old getting Alzheimer-type diseases, Guillain-Barré exploding, people having epilepsy exploding, narcolepsy exploding. The media admits linked to vaccines. But you define and written some of the most prestigious papers decades ago that are now mainline science on chronic brain inflammation. So let's start with the statin drugs and Alzheimer's. Dr. Blaylock.
Thank you, Alex. Good introduction. The statin drugs have been known to be troublemakers from the very beginning when they were first manufactured almost 20 years ago. Now, the promise was that when this was our major weapon against heart disease, it was just so impressive, we were going to slash heart disease. Well, 20 years later, the incidence of death from heart disease has not changed at all, or very low. If what they were telling as propaganda, and it's pure propaganda, not medical science, was true, it should have slipped to at least third or fourth in the incidence of death.
So, doctor, that means it's gotten worse because, what, about half the people that were smokers since then are not smokers, and that's, yeah.
Yeah, so it was a lie from the very beginning. Well, then when the statisticians started looking at what they were quoting in their advertising, which they advertise in every TV program and popular magazine, when they started looking at statistics, they said, well, you know, these are doctored statistics. That literally they're true, but when you look at the actual reduction in heart attacks, it's no more than 1 or 2%. But because they manipulate the numbers, which I show in my newsletter, it comes out 30%, 36% reduction in heart attacks.
But is it the 1 or 2 because there's been a massive reduction in cigarette smoking?
Well, yeah, that's played a big role, and people are more often exercising and changing their diet. But they leave that out of these statistics. You know, they're just taking the raw statistics. Well, you read the major papers that they constantly quote, they leave out things in the conclusion of the paper. And we're seeing this more and more, is that the conclusion of the paper does not match the data that's in the paper. Well, most practicing physicians do not read the data in a scientific paper. They read the introduction and they read the conclusion. A lot just read the abstract. Well, if you read the paper, for instance, one of the often quoted papers said that there was increased death from brain hemorrhages. That is never even mentioned in the conclusion of the article. Well, I think that's kind of important. Well, there's a research article in which looked and reviewed virtually every paper written about statin drugs since its inception to see what is the complications associated with it, what is the rates of complications, and the seriousness. Well, I reviewed this in one of my newsletters and went through all of them. Well, the list is so long, it's unbelievable. But we have things that vary from muscle weakness, muscle pain, death from a condition that destroys the muscle, including heart muscle, paralysis where they can't even get out of bed, to increased incidence of ALS, which is considered 100% fatal disease. And the effect on the brain and the heart were the two that were really stand out because they're so common. The incidence of heart failure since the introduction of statin drugs has just grown astronomically. Well, a physician looked at this, reviewed the data, and demonstrated that this was because of the statin drugs. Well, the heart is very energy dependent because it's always beating, it never really rests, and it requires high levels of coenzyme Q10 for its energy. Well, the process, the enzyme that produces coenzyme Q10, is also the one that produces cholesterol. This drug blocks that enzyme, so it's not only blocking the production of cholesterol, but also coenzyme Q10. That means the heart now is deprived of its major energy molecule, and so it explains why we're seeing this virtual explosion of heart failure. And it's occurring at an earlier age than
And now they're talking about putting statins in water for 3-year-olds and up.
Oh, yeah. Well, you see, they were talking before the water episode, they were telling the pediatricians, you need to start doing lipid studies on all children, and if they have elevated cholesterol, try the diet first, but if their cholesterol doesn't correct, then they should be put on statins for a lifetime.
Unbelievable.
Well, one of the secrets of statins, I wrote about this for years, that the only reason there's any effect of the statins at all is because it's a powerful immune suppressant and it's anti-inflammatory. It has nothing to do with lowering cholesterol. Now they're starting to admit that, even the mainstream journals, because the evidence was just so overwhelming. Well, who would want to take a child, 6 or 7 years of age, and suppress their immunity for their entire life? That's going to have two effects. Number one, it's going to dramatically increase their incidence of cancer. And two, it's going to increase their incidence of infections. And that's going to say, well, we need more vaccination. So they like the idea of producing mass immune suppression, epidemics of infectious diseases, and so the public would agree, oh, we need vaccines to protect our children.
Let me stop you. This is so cold-blooded. For those that don't know, obviously you suppress the immune system. It's the immune system that stops cancer. I was reading a paper a few months ago where they said now they've got new tests with a blood test that can pick up cancer markers. But people have got cancer every week that our own body defeats. Now they're going to have millions more people they can rush in with CAT scans that up your chances of cancer. Oh, we found something. Now we've got to put you on chemo. I mean, this is just a cold-blooded business by these people, but think about it.
Well, it is business because it's paying no attention to the science. You know, if you look at the science of cancer, you look at the science of degenerative brain disorders, you look at the science of degenerative heart disorders, it's the exact opposite of what's being done in the medical establishment. It's almost as if they're sabotaging people's health. And when we look at the incidence of disease, we're seeing degenerative brain disorders in young people now. It used to be confined to people in their, at least after age 55. Now we're seeing age 40, age 30, age 20, in growing numbers. Well, as you start putting larger and larger percentages of the population on drugs that are known to suppress the major energy molecule of the body, it's going to have a profound effect on brain function, heart function, and it's going to have a profound effect because of the immune suppressing ability